Good morning, everybody. I'm John Casper with the Oshkosh Chamber, and I really appreciate you all joining us again for these seem to be weekly events for us, our virtual town halls. I think we've been doing these since April and had a variety of different topics, ranging from how to go back to work safely to updates from our local units of government institutions and that sort of thing. Got a lot of, first of all, I'd like to remind everybody that this is being recorded, so if you want to go back later to watch the video, you can do that. It'll be on our website, archived, and we'll be sharing it with others. The other thing is everyone is muted. However, you can ask questions, and we ask that you use the Q&A tab on the bottom of the screen to ask those questions, and we'll go through those at the end and ask Andy and his team to respond to those. University's been a great leader in terms of response to COVID practices and testing, and their efforts have been great. I think is probably a gem among the UW system campuses throughout the state of Wisconsin. So we're very happy in that regard to have Chancellor Andy Levitt joining us and his team from the university to talk about what they've been doing on campus and things that we can learn from them, and you can implement and those protocols in your place of business to make sure employees are safe, customers are safe, and we all get through this this trying time here. So and then I'm sure you're going to be talking also about the rapid testing center that opened up on campus just a few weeks ago. So it's I was at that announcement with, it was great to see former Governor Tommy Thompson and now UW President. I guess he's still acting president. I think he's still acting like he's the governor too, but that's another.
So, well, we're happy to have him.
Yes. So with that, I'm going to turn it over to Chancellor Levitt.
Thank you, John, and it's an honor to be here today. Kim and Kurt and I, we are delighted to be here to talk to folks about some of the things that we've been doing at the university in order to continue to serve our students. Well, it's the week after Thanksgiving, and we are still here. And if you had asked us at the beginning of the semester what the probability of that would be, we'd probably say it would be quite high. Because of the plan that we had developed, but ask anybody else in the system, and I think that everybody is grateful for the fact that the UW is still certainly still in session. There's only two institutions that are still meeting face to face in the UW, and that's ourselves and UW Green Bay, just north of us, and so there are some reasons why it happened that way. And it really starts with very, very strong leadership. And I want to give a lot of credit to the system president and former Governor Tommy Thompson for providing the necessary leadership as well as the resources, certainly through Governor Evers' office, as well as other federal sources that we had access to that have allowed us to be where we are today. So it really was the right person at the right time in terms of the installation of Governor Thompson is our interim president. So this all started last spring, of course. In mid-March, we went completely online as an institution, as did every other institution in the country. We all went at the same time, pretty much in that same time period. We went off campus, closed the residence halls, and we miraculously flipped all modalities of instruction from whatever they were to all online, which is a Herculean achievement on our faculty's part. So really the heroes of the spring were our faculty, in that they moved very, very quickly to continue to have continuity of instruction with our students to finish the year. So the spring was all really about just finishing the year, as kind of a survival mode, if you will. When we hit the summer, then we had some decisions and some conversations to be had. What were we going to do in the fall? And one of the things that we did was poll the students. We sent a survey to the students and found that overwhelmingly the students wanted to be face-to-face. to the extent that they could be. And so this was really our North Star, our guiding principle, that we wanted to create the conditions that we could be becoming face-to-face. So if there's one decision that I have made as chancellor that I would hold above all the others, was asking our chief of police, Kurt Leibold, to serve as the leader of our Titans Return efforts, how we were going to react to the COVID-19 pandemic. And so I appointed Kurt at the head of a task force that went about working very hard over the summer to come up with a plan, the Titans Return plan, during the summer, which they did in very short order. A large group of people, faculty, staff. We had wonderful input from people from the community, such as Dr. John Newman from Aurora Medical Center was really helpful in terms of providing the necessary medical expertise that we would need, those things we need to consider. We worked very closely with Doug Guerin from the health department, of course, the Winnebago County Health Department. They've been partners since day one, and they've really, truly been very, very helpful in helping us achieve the success that we have. And then certainly our partners up at Prevea, that's Ashok Rai, Dr. Ashok Rai, who was the person who is responsible for bringing the testing capability to our campus, our three campuses, our one university. So we put a great plan in place, and that's really what it took. And then it was about implementation. We implemented through the month of August. We brought a lot of people back out of furlough in order to prepare the campus. And then the students came back. And then when the students came back, that's when our plan really contacted reality. And one of the great things about our plan was that it was flexible. It was something that we could look at the conditions that were happening in real time and make changes. Kurt and Kim are going to get into a lot more detail on these things and just giving you the highlights. And then in the end, the reason why we have a reasonably very, very small or even microscopic positivity rate when we're fully in session in face-to-face classes is because of our students. They really do deserve much of the credit. They've clearly modified their behavior. They modified their behavior so that they could remain face-to-face. And in one terrific meeting that at the system level we had as chancellors with Dr. Deborah Birx from the White House, who leads President Trump's response group, was that the students were masking and they were doing social distancing and they were staying well, primarily to keep faculty and staff safe. And this was evident all across the country. So it was her that said that universities are not the problem, universities are the solution. And that's certainly something that Governor Thompson has taken to heart, which led into the creation of these federally funded surge sites, testing sites that we have that we'll talk about today. So without further ado, what I'd like to do is introduce Chief of Police Kurt Leibold from UW Oshkosh, who is the person who's led up our efforts to respond to the COVID-19 pandemic. Chief?
Thank you, Chancellor. Thank you, John. Can everybody see and hear me? I was having some issues earlier.
Hear you great, see you great.
Fantastic. So how did we do this? I'm going to give you a brief tour through our spring and summer and how we got to the point today. So planning preparation is always the key. Was putting the right people in the right place. We sent home students on March 17th and almost immediately started planning their return. So the challenge was, how are we going to do this? How are we going to return students face-to-face classes during a global pandemic? We had to ensure the safety of the students, the faculty, and the staff, but we also had financial concerns. Providing the educational product is our business, and we had to be fiscally responsible. We didn't know if we were going to be receiving any funds to do this, so we had to do it within our budget. So where did we start? We started with what the chancellor said, with the task force, forming a task force. And you may wonder, and I get this question, why would the chancellor put police in charge of this? Well, here at UW Oshkosh, we have risk management and emergency management as part of the police department. And that works really well. And lucky for us, we also have a great risk manager, Kim Langhoff, who happens to be a microbiologist. So putting a lab together was pretty easy for her. So she'll get into those details as we go along. But I spent 26 years policing in the city of Milwaukee before I arrived at UWO. So I've seen many emergencies and many disasters and trained to be able to handle that. And this is really what this is. So the task force strategy is built upon facilitating and developing ideas, creating opportunities so we can solve major problems. You have to put the right people in the right place also. So we brought together a diverse group of people from this campus that had very unique skills, but they also had to think outside normal university processes, communicate effectively without fear of conflict, and have a positive attitude and work ethic. So passion for the success of UWO was a must. And the beauty of the task force is we could solve a problem quickly. This was the first pandemic, obviously, that we've had to deal with. We dealt with a norovirus in 2018 on campus, if you recall, which gave us a little bit of foundation to build from. So the mission was clear for this group: develop a blueprint that we could implement that was flexible and nimble, which offered face-to-face classes, high-flex classes, and hybrid classes that we could easily transition to back and forth if we had to. We had to do this within our budget, and the group had 3 weeks to get this done, which would have put us by the end of May, beginning of June, because we knew implementation for this plan was going to take all summer long. This team also did a lot of research, and this was key to being part of a university. I wasn't used to being around people that knew how to do research very well, and that's not knocking on my fellow cops, but they did it very well. So we read a lot. We read Johns Hopkins University guidance for returning to universities face-to-face. We studied Harvard University's key metrics. We looked at what was happening in Europe and Asia and how they were responding to the coronavirus at the time, and looked at what was working for them, what wasn't working for them. And as the chancellor said, we consulted with our local experts. Dr. Newman was so valuable to this team in helping us guide our plan. Dr. Ashok Rai, without him, testing wouldn't have been possible to help guide us through that. So Winnebago Public Health has been, like the chancellor said, by our side the entire time, and we've needed their guidance as well. But we also looked at corporate America. We looked at how they were returning their employees to work, and they do things very well in corporate America. And we took a field trip to Oshkosh Defense, and we studied how they did their return to work, and we're very impressed with how they did their plan, and we copied a few of their things as well. So implementing the plan was another challenge all summer, like I said. So we developed COVID procedures. Matter of fact, we developed 8 university-wide procedures. We developed 52 department procedures for COVID response. And this is to ensure accountability and to reduce risk as we went through the semester. We had to streamline existing processes. We had to get out of our own way, essentially. Single source of procurement was key. Streamline our decision-making process was another key factor to our success. Communication had to happen throughout. Constant communication to our faculty, staff, students, parents, and the community was done through town hall meetings, emails, and various videos we put out. The Titan Return website was stood up almost immediately, and we also required the Titan Pledge to be taken by every employee and student that returned to campus. The development of a front-facing dashboard was key to maintaining the confidence of our community. They needed to see what was happening with the virus and what our positivity rate was. We prepared at the end of summer by doing tabletop exercises. We anticipated a surge when all of our students came back. We practiced for that surge, and we made sure our community knew that this surge was going to happen. Confidence, like I said, in this plan was essential for success. And the only way we're going to have success, we realized, is if every part of our plan was operating at a high level. If one part of our plan failed, then the entire thing could collapse. So that's a key point right there. So as the semester started, we implemented our Emergency Operations Center team. This team is modeled after a police department's fusion center or an intelligence center. So every day, and actually our intelligence center at UWO was developed for crime and disorder, way to monitor the data around that. And we transitioned that into the virus data, and it actually worked quite well. So every day we have a 14-member team, which are subject matter experts from this university. They meet 2 hours every day, and they analyze our positive case data We look at internal data. We look at Oshkosh census tracts 5 and 7, where our students live off campus. We look at Winnebago County, Outagamie County, and Fond du Lac County's data as well. We're looking for trends. We're looking for trends in our residence halls. We're looking for trends in the neighborhoods in those census tracts. We're looking at trends through athletics, Greek life, for example. We monitor social media, and we're on top of rumors that are happening in our community. We have to stay on top of that stuff. We look at social media to see where the parties are happening or where these super spreader events might be occurring so we can head them off. We develop isolation and quarantine on our campus, and we monitor capacity and the services we render every day. It's very important, obviously, to our parents of our students that we're taking care of their students when they're in isolation and quarantine. We trained our own disease investigators and contact tracers. These are our coaches and trainers that are, for the most part, doing this. They trained with Winnebago Public Health this summer, and they're doing a fantastic job. They really relate well with our students. They are our detectives. They're out there finding where the virus is happening, where it's being spread. We have compliance, which is another key point. If we're not holding our community accountable, there's no way we could control this virus. So every day we look at compliance, where our violations are being reported. We set up a website that allows easy reporting of people that aren't following our protocols. We also take a look at what is observed. We listen to the Oshkosh Police Department because they're out there where our students live. We also listen to public health because they're keeping us informed of where we may be falling down as well. Our custodial and facilities are key to the effort also. To disinfect our environment helps with the confidence of our communities. So our goal is always to search out and find this virus and develop interventions to reduce the spread. We never ever wanted to be on our heels. We never wanted to react after the fact. And we succeeded in this so far because it was a total effort. It was a total team effort. Nobody gets to sit on the sidelines during a pandemic, and our community really responded to that. So my hat's off to our students, faculty and staff, because they really made this happen. They complied. They adapted to this new normal. And the students were doubted from the beginning. Nobody could believe that they could actually do it, and they actually proved us wrong. So with that, I'll turn it over to Kim because she can talk about our extensive testing operation.
Thank you, Chief Leibold, and good morning to everybody. Just listening to the story told from back in March was actually kind of eye-opening today, even though we lived through it. I certainly can remember how we started and what our strategy was at that point, and it's just continues to evolve as we continue to move through this COVID pandemic, and it is quite remarkable to hear it again. So as Chancellor had mentioned and the Chief, I am the Director of Risk and Safety and Sponsored Programs at UW Oshkosh. So I work primarily with grants and research, which is my background in microbiology as a researcher myself, and also manage the risk for campus. So when COVID came along, it was sort of right in the wheelhouse of something that I've had at least some experience with, both with risk and safety and with microbiology. So that was just a right place at the right time. Our testing program, and the Chief touched on this a little bit, but our testing program has really evolved very quickly. And as all of you are aware, COVID was a novel virus. So we just continue to learn more and more and more as research comes out. And we've just had to embrace that and been okay with change and with new guidance that comes out very, very frequently, and allowed ourselves to change and adapt within a moment's notice. Really, the goal from the beginning, though, with the Titans Return Plan back in June was to test as many people as we can, as often as we can, and as quickly as we can. And we knew that we had to get results to our students fast because they are 18 to 24-year-olds who want that information readily available to them so that they know the next steps and what they can do. And so through Governor Thompson and our UW system, they were able to allocate a rapid antigen test for our students. And that rapid test, we get results within 15 minutes. Despite what some rumors out there, the sensitivity and how the test actually is effective is very high, 97%, where we're seeing accuracy on that test. And what it allows us to do is to have a student come in, they go through a testing process. At the site. It's within 2 to 3 minutes, and they get a result anywhere from 30 minutes to an hour after they visited that day. So it's a very quick turnaround. And again, not that that fast is always the best, but we certainly know that that helps our compliance and it helps our students trust that test and come back every week. So that was really important to us. The other piece is as the semester carried on, we were able to increase our testing as the semester went on. So we started out doing 200 tests a day. We are now at the end, nearing the end of our semester, and we're at around 650 tests a day. And the reason that's important is because we are bringing a community of students back, squishing them together and putting them in close quarters within those residence halls where they live, which is obviously a little contradictory of what we were doing in a pandemic. And so the way we could do that safely is by testing a lot. At our LB testing site, which is located right in the central part of campus, so students actually walk by probably on a daily basis going into our Weve Memorial Union. Um, to date, we have tested over 25,000 students, we have ran 25,000, over 25,000 tests, of which a little over 1,000 of those tests have been positive. We're averaging now within the last 4 weeks almost 3,000 tests a week. And our percent positivity since October has been less than 3.5%. So we, as our chancellor had mentioned, we did see a surge. We prepared for it. And we saw that surge about 10 days after our students got back. So we know that they were learning the rules, they were figuring things out. But since that point, we have not seen an increase, and we have not seen a surge at this point either, even returning after Thanksgiving. Again, we were prepared, but I think our students have really gotten to understand wearing a mask, staying apart from each other, and and washing their hands, and that's really made such a difference. Um, I want to shift gears just a little bit to talk about our new site that has recently opened at our Culver Family Welcome Center, and that site, we are working with the the federal government through Health and Human Services, and they have set up a new type of surge testing site in Wisconsin at all of the UW campuses. And that surge testing site is using a rapid antigen test similar to what we use for our students. However, it's essentially now looks like a credit card, and it does not require a machine, which has been just a tremendous benefit because of how quickly we can process those and then how quickly we can get results. So currently at the Culver site, we have now opened it up only to the community. So we don't have appointments set for our students and our staff. We open them up, so we have 800 tests a day that are available to our community. We had maxed those out last week before Thanksgiving, and we have been hitting pretty close to that maximum every day. And so we opened on November 6th, and to date we have ran 9,000 tests at the Culver site. So you can see that's within, a couple of weeks. So you can run a lot of these tests very quickly. It's a self swab, which is a little bit different. So if you've gone to a drive through, sometimes they're using that self swabbing, and then somebody is observing them. So people come in batches, they get their swab, they do it themselves. They give it to a technician, they process the test, and then those individuals wait in their cars until their test results. And we're getting the test results back within about 20 to 25 minutes. And based on that result, we either have you come back in for a PCR test. And the reason we do that is if you are having symptoms and you have a negative result, we just want to make sure that that we are not that you are not too early in the infection where that test may not have caught it. So you come back in, you do the same thing, self swab, and that gets sent out for a PCR, which are turned around in about 48 hours. The same is true if you are not having symptoms, but you get a positive result. Again, we just want to make sure that if your symptoms aren't matching what those test results are, that those are being followed up with an additional test. But it's a very quick process. Like I said, 3 to 5 minutes, you're in and out the door. You get your results within 20 minutes, and then you can move on with your day. So again, I think even with the self swab and having people watch you, we can again see more people. So the goal is really the same at this site. It's really a demonstration of, again, testing as many people as we can, as often as we can, and getting your results as quickly as you can. So that's been really important. And I think for the most part, the community has been really happy with that, and obviously always open to hear feedback, because we again want to create an easy and accessible option for testing, so that people can understand if they are having symptoms and they know where they're at. That percent positivity at our Culver site is higher than at our LB site, since we are just focusing on the community. We're at about 13% right now. And this site should be open through December 18th. I know that our UW system partners are doing everything that they can to try to keep this site open, but as of right now, we are open through the 18th. Um, so as we've kind of developed these testing centers, the strategies, we've gotten some attention from the CDC and from our federal partners at Health and Human Services, because we've just been we've been able to mobilize the testing efforts in a way that we can test just so many people. And so we've been having the CDC do some validation studies for us, which will be essentially they will take the antigen test and compare it to PCR and see how effective it is. And so that was done back in September, and those results looked very promising, meaning that our antigen test, when they're positive, the PCR test is positive. When the antigen test is negative, the PCR test is negative. So that has been a very helpful tool. Again, we're a university, so we don't just want to test people. We want to understand the science behind it. And so I think by having this really close partnership with CDC, we can take our operation and also continue to use research and science behind the scenes to drive our strategy. And we've really worked hard at that, and which is why it continues to change and evolve. And not just testing more people, but how we're testing and the frequency of our testing. That's been very, very important to us. The Surgeon General was at UW Oshkosh on November 6th and visited our site, and really expressed how using this strategy is how we tamper the virus down and try to stomp it out. And hopefully other states and and hopefully going into our communities, our K through 12 schools, if we can get cheaper, faster tests and being able to test more often, will hopefully help decrease our viral load within our communities. So that was a pleasure to meet with them, and just to get feedback, and hopefully can replicate what we're doing in the Oshkosh community in other communities all over the country. And so just to wrap up, things that I think that we've really learned is to be persistent, to keep testing through, even though we know we're going to have if we would have a surge, we test through it, we get kids isolated, we get them quarantined, and we educate them. And for the last 6 to 7 weeks, we've really seen that has worked. We've also had to make sure that our students and are showing up to get their tests. So compliance has been very important. Everybody is wearing their masks. I even walk, if you get an opportunity to drive through campus in the middle of the day, all of our students, even outside, are wearing masks. They're very conscientious, and they've really been listening to the rules. And I think the major point, and something that we've learned throughout this, is that we have not seen any amount of transmission in the classroom. So wearing masks, sitting apart from each other, and has made all of the difference. And so we know that our classrooms are safe. And that's why our students are back after Thanksgiving. So that's just been tremendously important. And again, that that our students are really buying into that model. So hopefully we can continue to give them face-to-face classes, allow them to be back in the classroom and have some sort of normalcy during this really difficult time. So with that, I think I'm going to turn it back over to Chancellor, and I'll be ready for your questions.
Thank you so much, Kim and Kurt. Before we go back to John to moderate the questions, I just want to add one more thing that the university is doing, which I'm very pleased to announce. And this really was an initiative of Governor Thompson. Governor Thompson asked all those UWs that had nursing schools, colleges of nursing, what would it take to get nursing students into the hospitals to help when the hospitals right now are so overwhelmed with COVID patients. And so that's something that we have responded to, as has every other UW in the system. Here at UW Oshkosh, we have almost 1,500 students that are either nursing students or pre-nursing who are certified nursing assistants or CNAs. And those students have been asked to and have been incentivized to reach out to local nursing homes and hospitals to see where they could be most helpful. Many of these students are already working in those settings, but many are not. And so for that reason, we're able to put a lot more skilled or semi-skilled nursing talent right where it's needed most. And so this is something, another thing the university is doing, I think, to really help the community. So with that, John, if you wouldn't mind coming back, and we'd be happy to answer questions. And if perhaps Kim and Kurt can go ahead and turn on their cameras and just have them on and open, and we'll work through this together.
Yep, good. Well, we've gotten a couple questions from our audience. Some are process questions. I think I'll direct it to everybody, but if I think some are more appropriate maybe for Kim. The one that is more of a process question as it relates to the rapid testing center. Question came in is why apparently when results come back, sometimes they're inclusive from the rapid test site, but they're still required to come back and take another test. Can you talk a little bit about that?
Yeah, so if there are times where the test, it could be that the swab had some debris on it when you put it in your nose, or another issue with the development of the test. So that's why they're having you come back in if those are inconclusive. We just want to get you a confirmatory result. So that's why we have you come back in.
And also these tests are self-swabbing, so you do it yourself. What is the benefit of that?
Well, the benefit is that it requires less staff, so it does make it more. We can get more people through the testing site. So at our other site, to get through 600 kids, it takes like 7 or 8 swabbers that were doing the actual swabbing. However, at the Culver site, there's only 3 stations, and so we can have 8 to, yeah, I think it's 8, 6 to 8 people come in at one station. They can get those swabs done right there real quickly, and we can get you on your way. So it's just a more operational, we can get more people through. Really, it ups that throughput.
Now, there's a cost. I mean, it's a free test, but there's a cost to the federal surge site for the antigen and the PCR test. Can you give us kind of an idea what that investment looks like?
Yes. So for the federal surge site, those sort of credit card looking tests, they're $5 a piece right now. So they're very, very cost effective. And at our internal site, those antigen tests run around $23 a piece. Now, when you go to a place like Sunnyview, or again, all the tests are free for the community right now, but the PCR tests are about $100 a piece. So they're pretty expensive, and they take a very high level of scientists to run those. And so the benefit with those rapid tests is that you don't need as much training to be able to run those, and they're still very effective. And again, if you can come in and at the Culver site, feel free to come in if you want to come in once a week to continue to get screened. You can absolutely do that. That's what that site is for, and that's what we're really trying to encourage the community is to, or if you have local businesses, to come in and send your employees, have them come in once a week, get swabbed, and that way you know every week if you start to get those symptoms maybe a little bit later, that test will catch you on the next week, and we'll be able to get you isolated.
If somebody wants to get a test, I mean, what is, I know there's a process to go online and sign up for it. Can you talk a little bit about that?
Yes, I guess I did not talk about that before. I should have. So it is a website, and the website is do I need a COVID-19 test.com. It's pretty straightforward, but it's a little long. I could also see if I could put that in the chat. So it's do I need a COVID-19 test.com. And then you sign up for an account. It's very quick. It takes a couple minutes. And then you'll be able to select the Culver site if you put in a zip code within 50 miles of Oshkosh.
So how far in advance do you have to do it? Is it kind of a same day?
You can do it the same day. They'll show appointments that are available. Like, if I went on there now, we're open from 9 a.m. to 5 p.m. So if I went on the site now, there could be an appointment available at 11. I can run in there. And if you're not exactly on time for your appointment, that's okay, as long as you get there that day. That's the really important piece.
Now, you mentioned December 18th. Looks like it's going to be winding down. What does it look like moving forward? Do you see that being extended at all to the community?
Yeah, so I hope so. I really do. I know that our UW system partners are really working with the federal government to see if we can get additional resources. Again, this is sort of a pilot program, so we are the first in the country to be doing this, and so they're watching us closely to see how things are developing and how it's operationalized, and I think it's going very well. So we really hope that we can continue to give this as a service to the community. Um, we'll probably know here very soon if we can extend it.
I can jump in on that as
Sure.
well.
Thanks, Chancellor.
Governor Thompson is working very hard with the federal government to secure more tests. We think that the community testing has really been important, and that certainly community members who have come and received the tests have, I think, for the most part, have been very grateful. It's a different experience in that there's far less waiting involved in it. You get your results right away. We have the confirmatory PCR in case, in the event that you are if you're positive on the antigen test, or if you had symptoms and you're negative on the antigen test, you're going to get a PCR test as well. So we really need these testing sites. There's no question. I'm delighted that the UW, certainly UW Oshkosh, can be a part of it.
Here's kind of a basic question. I had the question too in my mind. So what is the difference between the antigen test and the PCR test? And kind of a follow-up, if the antigen test is positive and you're asymptomatic, why do a PCR test?
Yeah. Well, the difference is that the antigen test detects a protein. So the antigen test actually looks for live virus. So the virus is active. Um, it's a little bit less sensitive, meaning that it takes a little bit longer in the transmission of the virus to detect it. So it just has that higher level of detection. With the PCR test, it's a very, very sensitive test. So it will detect viral DNA very early in transmission, up to as soon as 48 hours. The PCR test, though, detects DNA. So it could be live or dead virus, which is why if you go in and get a PCR test, if you were positive a month ago and you go get a PCR test, it's likely it could still be positive, only because it's detecting that DNA, and you can shed that DNA for almost 3 months. And so by having the antigen test, it's a little bit better indication of, is there active virus? Are you really sick right now? So that's the benefit. To have you come back in to get a confirmation, it's really because we are just building that data set, right? So COVID, I mean, even though it feels like 5 years, it's only been here since March. And so this testing, as we continue to use different types of tests and different modes of giving those tests, we have to keep building up that data set. So until we get the strong enough data set, which is what the CDC is here to do, is here to show the Binax test, that rapid antigen test, that credit card looking test compared to PCR. Once we have more information, we likely won't have to do as much follow-up.
Question as it relates to positive tests and how those are accounted for. If let's say I go in, I get a test, I test positive, I come back 2-3 days later, I test positive again, and let's say I do it one more time, I get positive again. Am I counted 3 times as positive, or am I just one positive case?
Yeah, that's a great question. So it also depends on what type of test you're getting. So if you get an antigen test, um, you will be considered a probable case, and only one time though. So if you went back and got 3 tests, it's only counted as one case because it's for one person. For PCRs, it's the same thing. Those are confirmative cases, and so they're still counted in our caseloads at DHS, but you're not counted more than one time if you're coming in within that certain time period. Now, if you came in, 90 days apart, it would be counted again. But again, it's kind of focused on the patient and less on the test, on the number.
Question came in, the student body itself. I mean, how many students have tested positive, and what has been that positivity rate?
Yeah, so we've had a total of a little over 1,000 positive cases at our LB site, which is our internal site, and we like 90% of our tests are on students. And so I would say it's probably right around that 1,000 mark for the positive cases that we've gotten. But all of our resident students, we have about 2,500 resident students. They test once a week, so they do test pretty frequently. And then we also have about a quarter of the total tests that we run are off-campus students. So typically we see a higher positivity with those off-campus students versus the on-campus. And that kind of makes sense because our off-campus students are really embedded in our community. So if our numbers are higher in our community, they creep up in our off-campus students as well.
Well, a burning question in everyone's mind is, and this is for Chancellor Levitt, is the WIAC playing winter sports this year? And apparently the Midwest Conference just canceled today. So what does that look like?
We're going to be meeting on December 11th as the chancellors will be meeting for the WIAC to make that final decision. We had made a preliminary decision to cancel all competition prior to the 31st of December. So we were still left open the option. What the issue is, so that everybody understands, it's testing and the availability and the cost of testing. As you can imagine, there is some real reservations about having taxpayer money being used to test athletes for the purpose of participating in athletics. And so the testing centers that we have been operating, we have not explicitly tested athletes because they are athletes. We test them because they're students. And so in other words, they fold into the normal frequency of testing that any student would. But in NCAA, in the rules, if you're going to be competing, you have to be tested 3 times per week. And that's a lot. That's a lot. So right now, we don't have the resources available, nor does anybody else in the WIC, or quite frankly, anyone in Division III have the resources to test. And that's the reason why the Midwest Conference, well, that's Midwest is a different division, but you'll see a lot of the D3 conferences are now going to start to fall out for that reason. D1, they can afford the testing, but you can also see what a mess that's been.
Question came in. Has anyone calculated what the spread in the community has been from, let's say 1,000 positive cases from UW students?
I would argue the opposite. And here's why, is that first of all, if you look at our positivity curve on the website, on the dashboard, you'll see that our students didn't start getting sick until about 7 to 10 days after they arrived. And so I don't believe that the students themselves brought the virus to the community. I think that there was some level of infection, and then the students certainly traded it around within their own community. And certainly we got a handle on that by increasing the frequency of testing and also having a very aggressive strategy of pulling students out and they were put in isolation, or if they were close contact, they were put in quarantine. At the height of isolation, we had 150 students in isolation at one point, and they still were able to attend class, I might add. They attended it online. That was really a testament to the students themselves. Since that time, that 1,000 has really been spread out over the last 3 months to where it's a very low level each day that are getting infected by COVID. And when we were testing to send people home from Thanksgiving, we would test 600 students and there would be 4 that were infected. So we sent home well students for Thanksgiving. So I don't necessarily think that the students themselves are the ones that were the major propagator of the virus in the community, though I'm sure that there was a factor like any other group of people would be. So I think for the most part, once they figured out how to mask and how to socially distance, and they just made a decision they wanted to stay on campus, I think they really fell in line with what we were asking them to do. Chief, you have anything you want to add to that?
No, that was well said, Chancellor. And just we track the census tracks. We know our students off campus as well, and they've been around 5 or 6% of the daily positivity rate. So that's pretty good for that age group. And we work with public health very closely. We ask those questions. You know, we make sure that we're all on the same page. We don't want our students spreading this virus, and same as we don't want the community spreading it in our community. So it's been a good partnership.
So what is the frequency of student testing? I mean, everyone has to, is it once a week or?
Yeah, our resident students, that's around 2,400. They get tested every week. Our off-campus students are also encouraged to come in once a week, but we do not require it. So they typically come in when they're either feeling sick or they were a close contact, but there are quite a few that will come in every week just to get that sort of proactive test.
Sure. Okay, great. Well, it looks like we're running to the end of our time allotment here, and I think we've went through all the questions that came from our audience. You know, a couple things. Chancellor Levitt mentioned the UW's Oshkosh dashboard. That's www.uwosh.edu/Titans return is the website if you want to look at that. And again, if you're looking to get a test for employees or your any individual, it's do I need a COVID test or COVID-19 test.com is the way to get that in process. So with that, you know, we appreciate Chancellor Levitt and Kim and Kurt joining us today. Very well done. Great information. Something we're very proud of. The university has really taken a lead in terms of not just in this community, but also the state of Wisconsin. So we love to say that you're our own. So that's all good stuff. So again, we recorded this. It'll be on archived on our website. So if you want to go back and review this video, it'll be there probably sometime this afternoon. So with that, thank you for joining us. Our next virtual town hall is with our Congressman Glenn Grothman 2 weeks from today, 10 o'clock. He should have some interesting insights in terms of things that are going on in Washington. It's pretty quiet there these days, you know, so he should have some insight in terms of what's happening there. So again, thank you all for joining us, and we will see you soon.